Welcome to the Guardians of Hope podcast, where we bring together parents, nonprofits, legal, and medical experts dedicated to positively impacting children's lives. I'm your host, Cynthia Ramsaran. The thoughts and opinions of my guests are not necessarily my own, so thank you all for joining and sharing. Okay, welcome everyone. Today we are tackling one of the most challenging yet common scenarios many families face: navigating puberty and perimenopause under the same roof. Picture this: you're dealing with your own hormonal roller coaster, hot flashes, irregular periods, mood swings, and brain fog, while simultaneously trying to support your teenager through their own hormonal upheaval. You're both experiencing dramatic changes in your bodies, but neither of you has clear answers you need to understand what's happening or how to advocate for proper care. Our guest today, Dr. Amy Beckley, founder of Prove, understands this struggle intimately. After facing her own fertility and hormone challenges, she created the first FDA-cleared at-home test to confirm ovulation. But her mission has expanded far beyond fertility. Prove now offers comprehensive hormone testing that can help both perimenopausal women and their families understand what's happening in their bodies. Welcome, Dr. Beckley. Thank you so much for joining us.
Thank you so much for having me. Excited to be here.
Of course, me too. So let's start with the reality that many of our listeners are going through. Mom is going through perimenopause while her teenager is navigating puberty. Both are dealing with hormonal chaos, but often in isolation. How can families approach this as a shared experience rather than two struggles?
I think it's important to know that you're on both the bookends. So, you have ovulation, you have menstruation, you have a cycle. So your ovaries have a job and they start at puberty, then they end at menopause. And so you have one individual that's starting her ovarian function journey and then another individual who is ending her ovarian function journey. And so I think if we could just say, you know what, it's the same thing that we're going through, it's the same hormones. I think it helps kind of normalize it and help say, you know what, I'm going through the same thing. It's not as different as we think it is. This is definitely how I would approach it.
Mhm. Okay, great. Well, thank you for sharing that. Now, you created tools that give women concrete data about their hormones. Why is having this information so crucial for advocating with healthcare providers? I know I'm going through the same thing currently, and it can be frustrating. So, what happens um, if you don't have the information um, and you don't have the education about your hormones? That's the first question for you. And it's a series of others. I'll go.
Yeah, let's start about like a car mechanic. We always think like women going to the car mechanic, they're always going to sell us more stuff than we need because we just don't know anything about cars. And so if you say, hey, it's making this noise or it won't go, and you go to the car mechanic, you're relying on the person behind the counter to tell you what's wrong. And they could be selling you stuff that you don't actually need. And maybe they think that they're doing you a service by saying, oh, you have this dirty air filter, you got to clean it up, it's healthy. Oh, your tires need to be rotated. And they're trying to help you. But when you have a better knowledge of who you are and your hormones and things going in your body, you get to help guide that conversation. And so instead of just going in and saying, I just don't feel like myself, or I just feel off, what is it? It's just so many different possibilities. It's hard to get at a really good resolution as opposed to, you know what, I've been feeling a certain way. Maybe I put my symptoms into Chat GPT, or I Googled, or I had a friend that said this and they told me that, hey, it could be, my progesterone is low. Like, what is progesterone? What do you think it could be my case? And so it just gives you kind of like a way to have a better conversation so you can kind of see a little bit more eye to eye and have ownership in your journey. And so I think if you don't come in with that knowledge, you're just relying on somebody else, which is scary because when you rely on somebody else who hasn't had your life experiences, they don't have the complete story. And so it can be really, really difficult to find a good solution at an efficient pace.
Absolutely. So going to the doctor and being armed with this knowledge obviously gives us the upper hand, as advocates for ourselves, right? Now, how do we share this with our children? How do we share this knowledge and experience with our kids who are going through similar feelings and changes?
Yeah, I mean, so my daughter is 11. She actually might make an appearance because she's here.
Mhm.
And she's just had her second period of her life. And I taken it as an opportunity to educate. And, it's something she's going to have to live with. I mean, she was like, I don't want to go swimming because I don't know what to do while I'm on my period. So I don't want to have her have that burden on her for her entire life and question things. So I like to be very open. And, you could use this thing called a tampon. She's like, well, what is that? And I'm like, okay, it's this. It goes internal and you have to put it in this way, not this way. And she's like, yeah, not for me yet. We talk about, there's going to be secretions coming from your body. Some of them are normal and some of them are not. Here's when you should talk to somebody if it looks like this or smells like this. But during the normal process of making hormones and ovulation, you're going to have certain things. It kind of looks like egg whites. And she's like, ew. And I'm like, it is what it is. It's something you have to live with. And so I think it's just really important that you give her that foundational knowledge because she's going to have to live with this her entire, the next 30, 40 years, 40 years about.
Yeah. Yeah.
And so, it's a good third, fourth, or fifth of her life is going to be on her period. So she's going to have to learn. And I would rather her do that and feel confident that she can speak to her friends and other people as opposed to feeling like she's isolated and alone. Yeah.
Right. Yeah, absolutely. It's great. It's that being educated and knowing what's happening with your body is the best way to live, because then you know what's happening. You can talk about it with your friends. Like you said, she can educate her friends at school who may be shy to ask these questions. So this is wonderful. And you talked about some of the things that, your daughter or anyone going through any bodily changes due to hormones should look out for. What are some of the key things that a perimenopausal woman should be tracking, and a teenager, I guess, at the same time when it comes to hormones?
Yeah. So we'll talk about the perimenopause first. A lot of women have a um, incorrect education that menopause happens at 50 or 55, and it's when you don't have any more periods. I mean, that's technically true. The definition of menopause is 12 months without a period, and it typically the age is 51. But what people don't realize is that there's this perimenopause transition that can happen probably around 40 on average, as early as 35, as late as about 48. But in this time period, it's not like you have ovarian function, you're making hormones, and then all of a sudden one day it just stops. It's a gradual decline of these hormones that have different symptoms. And so a lot of the times the symptoms that perimenopausal women are experiencing, they don't equate to perimenopause. And so they don't know what to ask. They don't know what to do. Physicians are trained that I'm not going to give hormone replacement until you haven't had a period for 12 months. So it's really just a struggle. And so when you're in your 40s, late 30s, early 40s, the things that you should look for are brain fog. And it's not just forgetting keys. I was in the middle of a sentence, the middle of a thought, and I just forgot what I was going to say. Or like, I slipped. I can't say the words that are coming out of my mouth because I want to say couch, but I can't like say the word couch. Like that's brain fog. That's one of the first signs of perimenopause. Um, Closer together periods. So if you've had 28-day cycles, now you're having 25, 24-day cycles. That's a sign of perimenopause. Heavier periods. So, just more bleeding. That's another sign. Sleep issues. So either trouble sleeping, or a very, very classic one is waking up at about 3 a.m. and not knowing why.
Mm-hmm.
These are all the early symptoms of perimenopause. So there's two main hormones, estrogen and progesterone. People think it's all an estrogen because it's like, oh, hormone replacement, estrogen, estrogen, estrogen. All the symptoms I just described are progesterone because that's the hormone that goes first. And then when estrogen goes, that's your hot flashes, your night sweats, osteoporosis risk, those types of things. And so, when you're getting those initial signs, you should be seeking care. And in a uninformed, we just don't know enough about perimenopause. It's not the doctor's fault. It's nobody's fault. We just don't know enough. And women don't know enough about their bodies to ask the right questions that, we can go in at 40 and say, I think I'm in perimenopause. I have these symptoms. I don't think I need estrogen, but can I have progesterone only therapy or whatever that is? Because a lot of times, the other big one is anxiety and depression. They'll get put on anxiety medications when they should have been put on hormones. The real thing that you're supposed to be treating is this hormonal decline, perimenopause, that's causing brain changes. And instead you're getting on, antidepressants, anti-anxiety medications, which isn't going to solve the other symptoms that you have going on.
Yeah. All right. So we went through perimenopause, but what about the puberty portion of that question?
Yes. So puberty, I'm going to focus on the things that girls care about the most, facial acne, and bloating. And so typically a few weeks before a period, a teenager will break out, and that's because of the hormonal changes that they're seeing. And so I remember my daughter just got acne on her forehead, and she's like, Mom, everything I do, I can't get rid of it. I can't get rid of it. I'm like, I think your period is going to come. And sure enough, a couple weeks later, her period came. Another one is bloating, right? So your ovary is small and then it makes an egg and it gets a little bit bigger. And so you can see like different kind of things are going on in your body that's never happened before. So clothes just don't fit as well. Those are things that they should look out for. And then on the emotional side is, changing hormones is something that their little brains and their little bodies have never seen before. And they can get very, very emotional. My daughter would just cry when my son looked at her, didn't say anything, just looked at her. It's like, oh my gosh. And it's just, the hormones have receptors in your brain, and your brain are seeing these things for the very first time. And they just need to figure it out. It's like this transition period, and it's not bad. It's something that we just need to get used to. And just saying, oh my gosh, like just stop doing that. Don't act that way. And getting mad is not a good solution. A really good solution is tracking periods and tracking your mood. I have her tracking her temperature to help understand when she might get a period next, so she's kind of prepared. But studies have shown that if young girls are given tools to track their period, that they know that there's a certain 5-7 day window that they're just going to be an emotional wreck, but they know it's just 5-7 days. And then when they get past it, they're good. And so they've had less suicidal tendencies, less depression, and in a world where it's like, you're worried about what what you look like, and you feel like all the boys know that you're on your period, and you just, all these, things kind of go through your mind. So just letting them know it's normal. It's going to pass. You'll get through it. Support them along the way.
Right. Knowledge is power, 100%. Now we're just one more question for you about things to look out for and like symptoms. So we talked about all the normal things. What about some signs when something is not right, or there needs to be some sort of medical attention versus normal hormonal fluctuation?
Yeah, so things that are not right. So, young girls, all women that are ovulating produce cervical mucus. And so it is a, secretion from the vagina, and it's different throughout the cycle. And sometimes there's a lot of mucus that is produced. And if the body is not used to that, it can cause a yeast infection and a problem in the system because your body is just not used to having that wetness down there. And so, secretions that look like egg white, like stretchy or creamy, like lotion, and just don't really have an odor, those are totally fine, totally normal. That's what you're supposed to have. But if it starts to look kind of like cottage cheese or it smells like fish, that's where you seek medical attention. That's probably an infection.
Mm.
The other one is trouble urinating or inability to urinate, feeling like you have to pee all the time and then like nothing comes out. Those are good signs of a UTI or urinary tract infection. And you don't want those to go too long because then it could cause kidney infection and something kind of bigger. And so I think it's important, that they know what's normal because it wasn't normal last month when they didn't have their period, but it is normal now. And then when they should kind of seek care because you don't want them to feel like they can't talk to you and just it gets worse.
Yeah, absolutely. Thank you, Dr. Beckley. So I have one more question for you, and this may lead to another one. So forgive me. I'm just so curious about this topic. Um, Looking at the bigger picture, when we arm ourselves with knowledge about hormones and teach our kids to understand their bodies, how does this change the trajectory of healthcare advocacy for the next generation, for our kids?
I mean, it's got such a huge, profound impact. I think I'm a millennial. I might be Gen X, depending on what calendar you look at. I was born in 1980. And I'm right at that cusp of they just started giving everybody birth control. IUDs, hormonal birth control. You hit 16. Oh, you don't want to deal with with heavy periods. You don't want to deal with the acne, the weight gain. Like everyone just gets the pill. Everyone gets the pill. And I think it's got its place, right? Nobody wants to have unwanted teen pregnancies. But you also don't want to just mask your symptoms and forget about things. I ended up having endometriosis and infertility later in life and hormone imbalances that I could have addressed when I was 16, when I was told, oh, just you have heavy periods, you don't want to deal with these things, just go on birth control.
Mhm.
That was my way of being like, hey, there's something wrong with you. You could either address it or you can basically forget about it, mask it. And I ended up masking it. And then when I got married and came off pill 20 years later, tried to have kids, it's 2 rounds of IVF and $58,000 later. So
Yeah.
I think, it's always better to learn about your body and try to understand it than to ignore it or turn it off, because these are important things. I mean, we talked about when your body doesn't have these hormones, you feel anxious, you feel depressed, you feel sometimes suicidal. Like it has an impact on your brain.
Mhm.
Think about if you didn't have those hormones at all, like how is your brain rewired? Right. So it's like it's not just your ovaries or uterus that need these hormones. It's every cell in your body. It's your heart, your bones, like everything. And so I'm not saying birth control is bad. I'm just saying that you need to know, just like you go to the store and you can turn the product over and you can look at the nutrition facts and you can say this one's right for me or not.
Mhm.
Imagine if you didn't have that ability and someone just said, nope, you have to eat this. I don't care. Just have to eat this. You want to have that education where you can be like, yeah, that's actually not right for me and my body and my goals. I want to choose something else. So you have to educate yourself to know that there are multiple options.
Mhm. Absolutely. So this leads us to your Prove product. Tell us a little bit about how we can get it and how it works at home. After talking to you and looking on your website, it's pretty easy and anyone can use it at home. So tell us a little bit about it.
Yeah. So I invented Prove after I dealt with infertility and told IVF was my only option. It turned out to be a very simple hormone imbalance. So my almost 15-year-old son is an IVF baby, and my 11-year-old that just had her second period is just a hormone balancing, no advanced procedures needed. And that made me realize we didn't have access to our hormone information to be able to measure hormones at home. And so Prove is a system that works with urine. So you collect first morning urine, download the app. The app guides you when to test. And it's, pee in a cup, 10 minutes, scan it in, and it reads your hormones and it builds a report for you depending on what kind of life stage you're at. So if it's fertility, we're going to help you understand your egg count, your full 6-day fertile window. Are you ovulating well? Are you making this hormone called progesterone that supports pregnancy? Flag you for anything that maybe might be preventing you from conceiving. And then on the perimenopause side is, there is no good blood test for hormones because hormones fluctuate like crazy. And so we measure them in urine over the course of a cycle. We can see the fluctuations and we can know, are you still making estrogen? Are you still making progesterone? What are your symptoms? We correlate those with your hormone levels to help you say, hey, those symptoms probably due to this low hormone. And there is concrete evidence that you can go to talk to your doctor. You can either do holistic things, dietary changes to help you increase X hormone, or you can go ask for said hormone or whatever it is, but it kind of helps you understand your body and what's going on, what stage you're at, what hormones you're producing, why you're having symptoms, and then most importantly, how to get rid of them the most effective way.
Excellent. And what's your website so everyone knows? I'll tag you, or I'll paste it at the bottom, but just let us know your website.
Provetest.com. So PROOV test.com.
Perfect. Dr. Beckley, thank you so much for this informative conversation. I know you eased a lot of my tensions at home. So thank you so much.
Yeah, thank you so much for having me.